Today, tomorrow, Thursday and Friday are all days when you'll need to think very carefully if you or someone close to you needs a doctor anywhere in England. 4 days of junior doctor strike action have just begun, and the estimate is that half of the NHS's doctors will either be on strike or on leave this week. Professor Sir Stephen Powis is the National Medical Director for NHS England. Good morning, Professor Powis.
Good morning, Michelle.
What is your advice to people in England today?
Well, our advice is exactly as you have said. We're going to see 4 days of industrial action by junior doctors. That's the longest period of strikes we've had this winter. Undoubtedly, it will cause a significant disruption. We've been working hard with local hospitals, with local health systems to ensure that predominantly consultants, but also other staff are there to put in place the cover that is required in emergency services in particular. So that's A&E departments, critical care, maternity services. But those services will be stretched. So as you say, if you do have a life-threatening emergency, it's important that you still call 999, still access A&E. But for any other condition, then think carefully, use our services wisely. There are other routes to take, such as general practice, which will be affected, but much less so, local pharmacy, and of course, 111 and 111 online should always be the first port of call for advice.
So unless your life is in danger, do not go to A&E?
Well, use our services wisely. A&E departments are there for emergencies. There are other options available for minor conditions. And so our advice to the public is think carefully, because we will be seeing a lot of disruption over the next 4 days.
How many appointments will be cancelled or have been cancelled in total in the next 4 days? What's the number?
Oh, well, when we had the last period of industrial action a few weeks ago, that was 3 days, we saw over 175,000 operations and procedures having to be rescheduled. We won't get the exact number this week until the strike is over, but our expectation is that we will see considerably more than that.
350,000, is that credible, given that it's four full days?
I think it's difficult to put a figure on the moment, but as I say, I think it will be considerably more than the 175,000. It's 4 days this time, not 3 days, and of course it comes after the Easter holidays, and a lot of staff are on leave this week.
Well, and what is the impact of that? Because I wonder how much it changes what the BMA said was the reality in their last period of strikes, that because of redeployment of senior colleagues, a good level of patient care was maintained.
Well, we are, as I've said, working very hard to ensure those emergency services are kept safe. That is our priority. But I've also got no doubt that that cover is very fragile. So we are relying on consultants and other staff to cover the work that junior doctors usually do. Junior doctors are a significant part of our medical workforce, up to 40 to 50% of our medical staff. And so that cover is stretched thin in places. So it could be affected by sickness, by absence for other reasons. So we will endeavour to keep patients safe, particularly in those emergency services, but that is becoming harder every time we have this strike action.
So does it mean that you are not able to say that the NHS in England will maintain a good level of patient care in the next 4 days?
Well, routine care will be affected. So those are routine outpatients, procedures that are not life-threatening operations. Those services will undoubtedly be affected. We've asked our hospitals to ensure that they notify people in advance if appointments are being rescheduled. So the message is, if you haven't been contacted, then do turn up as usual. And we've also asked them to reschedule procedures and outpatients as quickly as possible. But this will take weeks to recover from.
But just imagine what falls into that definition of routine care. It's people like the lady we spoke to on Saturday, and who we'll run a clip of later, whose husband has been diagnosed with a serious condition, who's already waited months to finally get to see a consultant, to find out what treatment is available and possible for him. And his appointment was cancelled this week. That's the kind of thing where they're left with no guarantee of when they'll be seen, and that means they don't know when their treatment will begin.
Yes, and obviously we are doing everything that we can to keep those services running that we can keep running, but I'll make no bones about it. Strike action such as this does have a significant disruptive effect. We've seen that throughout the winter. We've made great progress in reducing waiting times over the last year. We hit our target of reducing long waiters over 2 years last summer, and we're close to our target that we have for this spring of reducing long waiters to below 18 months. But strike action does have an impact, and obviously we feel for patients who are affected. We will reschedule those procedures as quickly as possible, but this is a significant set of industrial action that's going to cause major disruption.
And one that ACAS hasn't even been called in on, the conciliation service. Would you want them to be?
Well, I'm not close to negotiations, but clearly everybody wants people around the table to try and resolve these disputes. I do remain hopeful. I mean, we have seen this winter nurses and paramedics, for instance, get round the table with the government and agree a settlement that they've been able to recommend to staff. So progress can be made, and we all want that to happen to avoid further disruption.
Yeah, I get what you're saying about you're not in the negotiations, not that there are any right now, but the BMA was saying yesterday that there are calls in this period between you and them. And in that process, there were no requests for derogations, i.e. for protecting some areas of cover. That was in the last set of strikes that happened. Is that right, that you didn't ask, for example, for emergency care to be exempt?
Well, what we've asked for is for derogations around major incidents, mass casualty events, and we have an agreement in place with the BMA. We've also agreed with the BMA that if there are circumstances where those particularly fragile services where cover is stretched, if they do run into difficulties, then we will have a conversation with the BMA.
Why? But out of interest, why didn't you ask for accident and emergency departments to be exempt?
Well, the BMA have been quite clear that the derogation that they were willing to give was a derogation around mass casualties, and they were not willing to provide derogations which were the result of the direct effect of strike action. But this time round, I think they recognise that we have worked very hard to provide the cover for services such as A&E. And if despite that we run into difficulties, then we will be talking to the BMA. As you say, we have regular meetings scheduled with them throughout the strike action, as we did last time. And we will have no hesitation in asking for them to assist if we feel that is needed.
Professor Sir Stephen Powis, thank you.
Thank you.
Time now